schizophrenia. So what is schizophrenia? Schizophrenia does not mean split personality, even though that's what's in the media most of the time. Schizo, split, phrenia, mind, actually means more scattered mind. Schizophrenia is a syndrome, so it's a collection of symptoms, which more or less can be broken up into three categories: positive, negative, and cognitive. But before we talk about that, I just want to briefly discuss some of the misconceptions of schizophrenia. This is probably the most feared psychiatric diagnosis and the most misunderstood. When people think of crazy, which is a terrible word, they often think of schizophrenia. They think of someone talking to themselves, hearing things, seeing things, homeless, generally behaving in a very bizarre manner. What is misunderstood is that schizophrenia represents a biological atypicality in brain function, and it can be treated. But unfortunately, as part of the syndrome, people who have schizophrenia often are unable to comply with treatment. This is a function of the illness and also a function of, at least in this country, a broken mental health system. I do actually see real patients, sometimes by telemedicine, and so I have to break these videos up into pieces, and I've decided not to wait until I have long stretches of time, but just to do it piece by piece. So you'll sometimes see videos that start in the morning and end in the nighttime, and that's what we're doing right now. So symptoms can be broken up, as I said, into three categories: positive, negative, and cognitive. Positive symptoms include symptoms that do not exist in the normal human experience. So they are things like delusions, hallucinations, disorganized speech, disorganized behavior. What does that mean? Delusions are fixed, false beliefs. So somebody might believe, for example, that you are trying to poison them. You are putting arsenic in their food, and they absolutely believe it, and there's no talking them out of it. They will arrange their life around it. They may even become extremely angry, even violent around that belief. And as I said, there's absolutely no talking them out of it. That's why it's called a fixed false belief. Those delusions can also be delusions of reference. So they can believe, for example, messages are being sent through the television or the radio, that there are special meanings attached to songs, poems, newspaper articles, that sort of thing. Hallucinations can be auditory, hearing voices. They can be visual, although that's less common. So seeing or hearing things that are not there. Disorganized speech is something that might sound like a word salad, so a whole bunch of words strung together that don't make any sense. Disorganized behavior is evidenced by, doing things that don't make any sense, have no particular purpose. So maybe putting on multiple layers of clothing on a hot, sunny day. People might also become catatonic, become very resistant to any sort of movement, maybe remain in the same exact position for long periods of time. All of these are examples of positive symptoms. Negative symptoms would be the removal of something we would consider to be a normal process. So, for example, something called flat affect, which is an inappropriate response to a stimulus. So maybe something very exciting happens, something that would typically make you laugh or act surprised or very scared, and someone with schizophrenia would just remain stony-faced and not have any response at all. Another negative symptom is Avolition or loss of motivation, loss of interest, loss of willingness to participate or interest in activities. They might actually just sit and do nothing for long periods of time. Another symptom is ambivalence, so inability to decide between two apparently or seemingly simple choices. There can be a flattening out of emotions and a general poverty of speech. So you might ask somebody with schizophrenia a question like, do you have children? And they would answer yes or no, instead of elaborating, yes, I've got 3 daughters and 2 sons, and they're this age. Instead, you get very brief answers. And the last category, cognitive symptoms. This is a little more difficult to explain, but in general, cognitive symptoms lead to difficulty with learning and memory and general thinking. In order to qualify for a diagnosis of schizophrenia, these symptoms have to be present in certain combinations over certain periods of time and represent a certain severity, but I won't get into the technicalities of diagnosis at this time. Schizophrenia is much less rare than people think. It occurs in about 1 in 100 people on the planet. It is present in about 23 million people worldwide, and it appears to have, at least to some degree, a genetic basis. What causes schizophrenia? Well, the short answer is we don't know exactly. The more complicated answer is there's significant evidence that it is, at least to some degree, based on neurotransmitter abnormality or atypicality. What does this mean? There's a lot of evidence based on the treatments we use that the dopamine receptor, D2, is involved in the genesis of schizophrenia. And that's really sort of secondary evidence based on the fact that by treating a dopamine imbalance, we can improve the symptoms of schizophrenia. So that the medication affects the dopamine receptor and restores the balance of dopamine in that space between the nerves. That space is called a synapse. Because of that, and because these medications work so well, we think dopamine is probably at least involved in schizophrenia. There are other neurotransmitters that are likely involved as well. Norepinephrine, GABA, serotonin, these also have been shown to play a part. So what is it like to have schizophrenia? Well, most people who have this disease are, first of all, born with the vulnerability to it. So it's not something that is done to them. It is not something that happens because of something their parents did or their mom did. People are born with a vulnerability to and may or may not manifest. We're not sure exactly why, but if it does, it generally is onset in the 20s. It seems to be onset earlier in men than in women. Most people with schizophrenia tend to cycle through 3 different phases throughout their lives. 3 phases: prodrome, active, and residual phase. The prodrome phase tends to be less and marked by the possibility of a higher level of function. During the active phase, there is often florid psychosis, lots more positive symptoms, and a very low level of function. And during the residual phase, again, less symptoms, possibly better function, particularly if there's treatment. Without treatment, schizophrenia has a particularly poor course. These cycles get worse, and the patient often deteriorates over time. However, with treatment and with support, and people can live a really high quality of life. So while it is true that people with schizophrenia have a reduced life expectancy. Recent research has shown that virtually all of this reduced life expectancy can be attributed to controllable risk factors. And what I mean by that is people with schizophrenia have significantly higher rates of tobacco use, high blood pressure, high cholesterol, obesity, hyperglycemia, and low physical activity. Once all of those things are controlled for, they have the same life expectancy as the general population. So it seems that schizophrenia itself may not actually lower life expectancy. That's the most recent research. So the problem seems to be medication compliance, infrastructure, mental health treatment, and general health concerns. Okay, so what do we learn? Schizophrenia is not a split personality. It has to do with this fragmentation in terms of thinking, a break with reality. The symptoms can be broken into 3 types: positive, negative, and cognitive. Illness, it's based predominantly on a malfunction in the neurotransmitters in the brain. It is to some extent genetic. It occurs much more frequently than people realize, probably 1% of the population globally, about 23 million people worldwide. The primary problem in treating schizophrenia has to do with medication compliance, and that problem is exacerbated by a lack of infrastructure and mental health services and mental health care, particularly for the population of people who suffer from schizophrenia, certainly in this country and probably in many, many other countries worldwide. Schizophrenia is really not a disease to be feared as much as it is to be tackled and better understood. I'm Dr. Schwarz, and this is Psych Talk. Thank you for listening. If you like this video, remember, please like it and subscribe. For more videos on psychiatric symptoms, check out the link below, and I will see you next time.